nature's best, Bobtail.
Welcome back with Expresso here on SABC3. Now, Dr. Roy is a veterinary surgeon. He's got extensive experience with both small animals and wildlife. He's worked in the city and in the wild African bush. And this morning he chats to us about dental care for our pets. Good morning and welcome.
Morning, Kia. Hi, nice to be here.
Tell us, what is the importance of healthy teeth when it comes to your pets?
You know, Kia, dogs breathe through their mouths and they eat through their mouths. And if the teeth are bad or unhealthy or there's infection in the mouth, then whatever they take in, whether it's air or food, passes through that infection and can take it inside. So keeping teeth and a mouth healthy is it's really important. Very
important. I see you've actually got some examples of them as well. Some for a bigger canine, and then of course you're looking at the smaller one over there.
Yeah, this is a dog, in fact. That's Bob's model, and this is a cat.
Oh, is that a cat?
Yes,
oh
it's
my gosh,
cat,
okay.
But the basic pattern stays the same.
Right, you can actually, you can see the pattern is quite similar. Now, when should one start with dental care or oral hygiene when it comes to your pets? What would be a good age?
The day they're born. Well, they're actually born without teeth, but as soon as they develop their teeth, it's a good idea. They do have, like us, they have milk teeth.
Right.
And their milk teeth fall out at between 4 and 5 months and are replaced by permanent teeth. There are a lot of people who believe that mechanical brushing is a good idea. I'm not a big fan of toothpaste, but if you want to, you can get these little finger brushes and brush your dog's teeth.
And that would be more effective. Yeah.
But don't forget, these animals are they're carnivores. They actually eat meat, and their teeth are designed, believe it or not, to chew and break bones. Now, some of the breeds like these have flat noses, and their mouths are changed, and they don't cope with bones that well. But if you have a dog with healthy teeth, they're designed to chew, and there are a whole host of dental things that assist in dental chews, that the dog chews these things and it exercises the teeth. It actually almost scrapes the surface of the teeth, because the big problem we see in private practice is what we would call dental tartar. That's kind of a browny, almost a concrete-like substance on the teeth, and you can't scratch it off. You need to take what we call an ultrasonic scaler. And under general anesthetic this is done. You scale the teeth. You actually remove the dental tartar from the teeth. If you don't do that, then the tartar tends to start undermining the gums, and you get what is called gingivitis or a gum infection, and ultimately tooth loss.
Now, speaking about the gum infection, what types of oral diseases does one get? And then also, what are the signs as well? How would I know as a pet owner that there is a problem?
Probably the first thing that you'd see is the dog would either be salivating. There'd be some sort of oral sign, licking its lips, salivating, reluctant to eat, reluctant to chew something hard. Maybe if you're feeding your dog pellets, they tend to want to not eat their pellets and prefer soft food. So as the owner, you just need to be observant. If your dog is showing signs of oral discomfort, eating, salivating, or very, very important, smell. I mean, smell your dog's breath. You know, a dog's breath should be what I call doggy, sweet, normal.
You'll actually know as well if you are a pet owner, you'd know what the smell is like.
Smell is really one of the classic presenting signs, and it's one of the reasons why people bring my dog's breath really smells bad. So that's a big one out there.
Okay, and then the lowdown on tooth decay.
Well, once again, you know, dogs they get caries. Caries are holes in the teeth. Dogs and cats get caries, but you know, the general attitude in the private practitioner is we remove the teeth, but we do have dental specialists who perform all the things that dentists do. They fill the teeth, they do root treatments on teeth with bad roots, and we've even had some dogs with capped teeth, with crowns, and I had a bull terrier once that we crowned its 2 front teeth with big stainless steel crowns.
Very cool.
The dog's name was Bullet.
Bullet?
And everybody was scared of Bullet, but luckily he was a total honey, and he just had this hectic, toothy, steel smile.
Lovely stuff. Dr. Roy, thank you so much for joining us in studio this morning. I think I'm going to be keeping a very close eye on my doggy as well, making sure that I smell that breath. Well, make sure that when it comes to your pet care or your pet dental care, that you start as early as when they start showing their first signs of those little teeth coming out. All right, now it's time for us to move over to our Express News and also news on your weather. That's next.